What's up, y'all? It is Connecting the Dots podcast time. I am your host, Kymmy Coco, and my co-host, Dom, and Jay Black, our producer. We welcome you. We have a very special guest today, the beautiful Patrice Little. Dr. Patrice Little, welcome to the show.
Thank you for having me.
Y'all, I can't see that good, so if you hear Dom talking a lot, it's because I asked him to kind of take over. But we have a lot of stuff to get into today, and I am so glad. Thank you guys for organizing this so we can have a conversation with medical professionals. A lot of them, they were heroes for everyone last year. Everyone from New York to California to Maine to Florida was paying our respects, giving our just praise to medical professionals for all they've done. So hats off to you and all the medical professionals out there.
Thank you.
And I know this year it might be a little bit different, but I still have utmost respect for you guys for rising to the occasion. I mean, everyone that joins the medical profession doesn't necessarily sign up for the reason that they should, but now the test is showing you how resilient these people are. So again, hats off to medical professionals. Tell us more about Dr. Little before we hear directly from her, Dom.
Okay. Dr. Patrice Little. Gotta say the doctor, you know.
Gotta say the doctor.
You know, people earn that.
Put some respect on that.
I don't have no doctor in front of my name.
Okay.
So when I meet people with that, title in front of them, I know they did a lot of work to get that. So we definitely thank you for coming through. But Dr. Patrice Little, I met her maybe 2 or 3 years ago. Just a very cool spirit, very knowledgeable, very helpful. I can definitely see why she's in the medical field,
Yeah.
Her spirit is just to help people. But she's a doctor of nursing practice, which is very important right now. We know that nurses and doctors and just the medical field, the practice in general, like it needs a lot of guidance right now because the medical field is pretty stressed out, and we'll talk about that as we get into the podcast. But she's a family nursing practitioner, board certified. That means she's the real deal. She, they went through all the rigors and the education and the field work to be where she needs to be. So we definitely appreciate you for coming on. She is a founder of ENP Student Magazine. ENP Student Magazine is a premier digital lifestyle and supplemental resource for nurse practitioner students. Since 2018, they have solely dedicated their time to keep ENPs updated with every aspect of their lives in and out of school. As a definitive voice of ENP students, they believe in highlighting extraordinary lives and linking students to resources to help them dominate their learning experience. ENP Student Magazine is the first platform to offer curated content to help nursing practitioner students throughout their life cycle.
So students, or even practicing nurses, check this magazine out. Make it a part of your routine. We're going to hear later about some of the initiatives that they have going on. But yeah.
Welcome to the show,
Welcome
Doc.
to the show.
I call it Doc P. So if that slips out like through the show, just forgive me. But that's like just what I call it.
Term of endearment, Doc.
Indeed.
Yes, and a lot of students call me that too. Yeah. So it's
I'm glad it caught on. It's just like, what up, Doc? Doc P. But welcome to the show. We're happy to have you today, and we definitely look forward to having some of your expertise in some of these conversations because, of course, we try to, I call it a community-oriented podcast.
Yes, absolutely.
We really try to speak to people on a weekly basis to really break down stuff into layman's terms. That's why we call it Connecting the Dots. We literally just try to connect the dots for people week to week because we know from week to week it's so much stuff that goes on. So just taking the time to break down things for people so they can understand a little bit better because as the famous philosopher Nas says, people fear what they don't understand. So we thank you for coming on here to help people understand what's really, really going on out here in the medical field in the middle of a pandemic where everything is just crazy. So, what's been your experience over this past almost 2 years in the pandemic?
Almost 2 years. Can you believe it's almost been 2 years?
Well, one of the things is that it's been a huge spotlight on just two things. The fact that we have still poor access to care for marginalized groups, which is really Black and brown people, what they call. And then the other thing is with nurse practitioners and nurses being burnt out because of the load. There's just not enough to handle that load and the rigor or the stressfulness that's come along with patients who have COVID-19. So they're labeled as high acuity, which means they require a lot of care. So that's really what's important. So when you have every single patient being admitted to the hospital that requires a lot of care, then it's really hard to meet the needs, and they're placed in a position where who's more likely going to survive, and who it's unfortunate, but it's almost like a survival of the fittest thing. So that's what's going on as far as in the clinical aspect. And then you got the research people like me who's always trying to create and innovate just to make things a little bit smoother. One of the things that I realized is that, number one, with the pandemic is also impact education for some of the healthcare providers or nurses, because of the fact that the pandemic, once again, the students, some of them are afraid to be in those settings because they do not want to get the COVID. We none of us want to get COVID-19 or the Delta variant of it. So you have that clinicals were placed on pause. Well, everyone knows, and for those who don't know, that the clinical, which is the hands-on aspect, is a very, very important of nursing training. So without that, they are really not prepared to function in the roles in the hospitals and in the clinic. So there's a lot of challenges, and so what you guys can do is just let me know which one you would like me to pinpoint, because the last one I want to talk about is something that has been going on for quite some time, and that's the area that I focus on, and it's that nurse practitioners. So just to give you a little background story, years ago, way before we were born, in the late 1960s, the nurse practitioner role evolved to fill in a pediatrician gap, and it was done in rural communities. And so they took nurses and they were trained by physicians or medical doctors, and they evolved into a role of a nurse practitioner. And then years later, the nurse practitioner model ended up being adopted by the nursing, by nursing. And so people were graduating with masters or now doctorates and to function in that role. However, as they became independent of what they were doing with the medical model, they were not able to provide enough preceptors. A preceptor is basically another way of saying a mentor or somebody to train you to prepare you for that role. So what's going on is nurse practitioners for quite some time have been trying to find their own preceptors. They're doing cold calls or emails at doctor practices and just all over to see if they can get someone to train them. This is not safe because it's not standardized. Now, every school, I must have a disclaimer, every school is not like this. I'm not going to name any particular schools because I don't need anybody emailing me. But there are a lot of schools. There's over 400 nurse practitioner schools in this nation. Many of those schools actually are very structured and have things in place where they find the preceptors, the trainers for you. But then you have those who are really about money. And sometimes they're labeled as diploma mills by some of our physician counterparts. And so they're more focusing on pushing out quantity than the quality of providers. And that's where the concern comes for you guys and your family. So you're like, well, what did Doc P just say? Basically, you and your family are at risk of not getting the care that you deserve when a person who is a nurse or nurse practitioner is poorly trained.
So I'm sorry.
No, you go ahead.
So once the government decided, or the I don't know who oversees the medical field. I guess there's some part of the government.
Yeah, there's a lot of there's governing bodies for nurse practitioners. It's American Association of Nurse Practitioners, and then of course you have those credentialing bodies like AACN, like for the actual schools, and the schools have to be accredited, and that's another topic because schools. Some people go through the schools and find out they're not accredited. Right. But that's completely different from the medical schools. They have their own governing bodies.
So once they decided to fast track, when COVID really got going and they were realizing that the nurses were in shortage, and so they said, okay, once you're in the last year of the program, you can get fast tracked out and get right out there in the field.
They're not doing that. What they're doing first let's back up just a little bit. The nursing shortage has been around for quite some time, And we always have to look at what's going on in the workplace. There's about 5 different generations in the workplace. You have those baby boomers, and the youngest baby boomer right now is like 57 years old. So within the next, we'll say 8 to 10 years, they'll be retiring.
Right.
So those old heads, is like what I call, they got a lot of wisdom. They seen and done just about everything. So when you move those out the way, you have my generation, which is they call the lost generation, Gen X, which I'm still at the beginning of millennials, so it's kind of crazy. But when you have some of us who may be leaving the profession too, and then coupled with the pandemic stress, so they're leaving because they're burnt out, then you have all of the people who have the wisdom experience gone, right? And so when the new wave, which is those who are graduating now and graduate last year, coming in, they don't have anyone to look up to or call on to. And so that's really what makes it a huge problem. They did not, the fast tracking as far as like the accelerated, I think that's what you're talking about, program for ASN, for the BSN, which is the bachelor's degree. That one has been around for quite some time. Actually, my first degree is biology pre-med. Nursing's my second profession, and I did the fast track. But I had such a strong biology pre-med degree that by the time I went to nurse practitioner school, I was able to pull on that, and it was easy to go about diagnosing. But to get back to the point, a lot of the students had to their training had to be placed on hold because their training for the RNs, which are the Bachelor of Prepared Nursing, is usually done at the hospital. And the hospital is where everyone has COVID-19. So that's a lot. There have been actually students who have succumbed while they were in the middle of their training. Yeah, one nurse practitioner shared that with me with a precepty. That's the name of the student who's being trained. She got COVID and died. So there's just so much going on that, quite frankly, it's important that I just focus on just one aspect, but there's so many things that we could
And I think when I introduce you, that's why I really keyed in on the letters on your name, because I know what you do. I've talked to you for we talk all the time, and so I think what you do is really important because you literally are looking out for pretty much an entire upcoming generation of nurses and people in that area. So
they're my sweetie pies.
and it's good to because even just me personally speaking, I have friends that are doctors and nurses and in the medical field, and just thinking of my own friends who have been doing doctoring and nursing for years, I can think 3. I'll say 3 in the possible, because one person on the fence that have literally just quit. It's very stressful for them. Between, I always said that the medical field is a stressful field anyway, because you're dealing with people. You're not dealing with people, you're dealing with sick people, and that's stressful in itself for a person to be sick. They're probably not going to be as nice to you, or, they have reasons to, not be happy. And then compounding all the things with the pandemic. I was reading an article, it says a major healthcare provider is suspending almost all surgeries because nurses are swamped with treating unvaxxed people with COVID. Intermountain Healthcare announced it will postpone almost all surgeries across several hospitals due to rising COVID-19 cases. It says the suspensions will occur for several weeks across 13 out of 24 hospitals within the system. That's almost half their hospitals. It says our teams are overwhelmed and we're running out of staff beds for patients. A press release from Intermountain said. So I think that's crazy. And
it makes valid sense because most of the time for people, so you have 2 different types of surgeries, and I'm gonna say 2, but there's a little bit more. But I call it elective, which is you're opting to have that surgery. For those of us who've had some elective procedures, I'm putting it out there. You opt in to have that, and it's not just cosmetic. It could just be, just other things as far as intervention. And then you have those that are necessary, and so forth. But most of the time, those individuals are healthy. Like, you know,
the surgery is not to save your life. It's to either fix something or something like that.
Yeah. For instance, and for example, we can just say like a rotator cuff repair or something like that. Like that
you can wait. You don't.
Yeah, you can wait.
It's not life threatening.
Exactly. So that type of surgery, it improves the quality of life, but that individual more than likely is healthy otherwise. So the thing is to prevent them from going into the hospital, someone who's perfectly healthy, so they don't get COVID-19. They don't have it. Now, I will tell you this just to give, for those who are tuning in, a little bit about my background. I do work like 1 day a week at a hospital, and I help a surgeon out, and we do an elective procedure. And there are so many things that we have in place in order to continue this. The population I serve is a mature population. I just say older folks. They're mature. So what happens is they're getting COVID. We have things in measure where they have to get a COVID test before they come in for the surgery, within a few days of having the surgery, making sure that they've been vaccinated. Our team had to be vaccinated because I have asthma, so of course I have to be vaccinated. And then I'm working around most of my patients. The youngest patient that I typically have is around like between 57 and 65. So most of my patients are a little older. And so those procedures, we have to have our surgery spread so far apart. The surgery that's usually done, it usually takes 15 to 20 minutes. We have to have things so spread apart so they're with the contact, so we could clean and do all of this stuff. And they don't have enough staffing to do that. And the thing is, to turn it back around to those who are tuning in, you guys, we just encourage you to get vaccinated and to understand that this pandemic is real. This is not a hoax. People are really dying. Most of us have already either had a family member who has passed from COVID-19 or have a friend who's had a family member, right? For all of you guys, or at least one person.
At this point, for sure.
At this point. So it's real.
That leads me to my next question, especially with you being directly in the medical field. And this is something we kind of touched on last week. Of course, having friends like yourself and other people in the medical field, like I see not only firsthand, but I hear.
Can I ask you something real quick? I get what you're saying. Yeah. But people in the medical field, some of them are still just people out here in the world with their beliefs. And sometimes those beliefs supersede what they learned in medical school. And I don't know where that started happening, but recently you can be on Facebook, right? And somebody say, oh, well, my sister's a nurse and she said it's not that bad. Or, oh, my friend works at the hospital and they're saying it's not full. It's always, you can't just say anymore, oh, this person's in the medical field. They have a whole group of doctors going out there spreading misinformation. The doctors, frontline doctors, those people that were with the white coats that were in front of the Capitol telling people to take hydroxychloroquine. For money. I'm not sure if those doctors are practicing, but just because they have a doctor prefix, people are more. So that can't be it anymore. You can't just say this person works in the medical. It has to be someone that really knows or cares enough about the community and about people to give them facts without, like you were doing this. People are doing stuff for money now. So that's why it's good to have someone that for a fact you're a credible person. You know for a fact that she's a credible person because you've seen her before it was politicized and had a genuine care for people. So we know that what she's going to say is going to come from a good place. That's all. I mean, I just wanted to make that interjection because I know people say this all the time. Oh, such and such, she works at the hospital and she said, no, that's not enough anymore. We have to have someone in the community that we know cares about our community. And that's why I'm glad that you're here today to help kind of walk us through some of this.
And like in layman's terms, where's the disconnect? Like, where are you seeing, because I know Kim's frustrated. Jay Black, he's voiced his frustrations at times, and for me, it's kind of like, once again, like I can look and I can see what's going on, where do you, being on the ground level and dealing with people, like where do you see the disconnect?
The disconnect.
And how do you think we can fix it?
I believe it's like she said it perfectly, between their opinions and what research says. Mm-hmm. Because, and I'm going to use this as an example, because I did Dom knows I love to educate. So I did, at the beginning of the school year, I did a demystifying myths about the mask and the vaccine. Because I had a lot of parents, I'm a part of like a parent group on Facebook, and I think it's like Gwinnett Women of Color group, and I was seeing some of the things that they were posting and things on my personal page, and I was just like, I want to do this as a gift to you guys, and this just naturally and so forth. It just with education, and I just broke it down in the sense that we have to think about masks. So, and let's talk about surgeries, because that's what you highlighted. Mm-hmm. Okay, so why is it for years we've always had to wear masks in the OR room?
I said this all the time.
I mean, like, why is it that we've always had to? I mean,
like it's not new for y'all.
Yeah, it's not new. It's not for new. Yeah, it's not new for us. That's one of the things that I highlighted, because we always have to look at the research. There's something that's called evidence-based medicine. That's what we follow as practitioners, and usually it's a
Say that again.
Evidence-based.
So, I just want them to hear that.
Yeah, that's my favorite. That's my favorite kind. That's my favorite kind.
Yeah.
The evidence-based.
Evidence-based. Like if someone does not have proof of really what's going on. And yes, research can be skewed for it to say what you want to say. But for something like this that has been part of standard of preventing, remember, years ago when people were dying, they were dying from infections, right? That's what they were dying from. Mothers having babies with dying from either a blood clot or infection, or the surgeons years ago, before they learned about cleaning their hands beforehand, like just basic hand washing before they move on to the next surgery, it was infections. So that's where all of this has come from. We learned how to minimize the spread of infections by having PPE, personal protective equipment. That could be a mask, goggles. Like, you should see me on Tuesday. I'm decked out. I have my bouffant cap. I have goggles, I have the mask, got N95 mask, then you got the surgical mask over that, and then you have we look like Smurfs. So I say all of that because the disconnect, once again, and I'll make more of a point, is between people just having their opinions. We always have to understand that for people who are like, oh, it's not that bad at my hospital. But your hospital is not the representation of the whole hospitals in the United States. Yeah. Like, we have to be realistic. And some of those people, you just have to look at them and smile and nod.
That's it. That's
don't even. And I put an article out on MP Student Magazine specifically about how to have conversations with individuals. And the number one thing that I had, was at the bottom. But the number one point that I wanted to emphasize is that you have to almost learn how to disengage. You give them the information and let them know that you're here. Like, hey, I'm here as a resource. I know this stuff. But you almost have to disengage. Because, for instance, I don't believe in getting premature wrinkles. I am not about to go back and forth with someone to prove to them the knowledge that, I already graduated. Like, I don't have to prove to anybody anymore. Right now, I function in a role of, and I just feel like when he blessed me to get this degree, it was so I could pour back into other people, to people who wouldn't normally come across someone like me who could just pour into them without making them feel bad. So again, I said a lot, but with that class or workshop, I emphasized the mask. And we know that we've seen the research with the Petri dish. And we know that if you cough and you sneeze and all that stuff.
Just talking.
But the thing about it is, why do we, when we sneeze, remember they say, well, don't sneeze in your hand because you're going to touch the stuff. But we were sneezing in our hand anyhow to prevent the spread, right? We were sneezing, and usually we say kind of sneeze, and and they're to prevent the spread. It's all about preventing it, because we know
for our entire lives, we've been covering our mouths when we sneeze. So where did that all get lost? When people were saying wear a mask,
exactly.
I don't get it. It's see, the social media world is I mean, I didn't grow up with it. I'm Gen X.
Yeah.
So I feel like there's a need to just have to talk. There's a need to just continuously keep and weigh in on everything. You don't have to weigh in on everything. If you don't know about it, just shut up.
Exactly.
Don't pick a side of a popular side, because people are being paid to spread misinformation. I don't know when I've grown up, and I said this on a previous episode, y'all. If you go back for your life before 2020, the nail tech had on a mask.
Yes.
The contractors that were painting your house had on a mask.
Correct.
The people that were mowing your lawn, they wore up until this point, you knew what masks do. It's when you talk, when you sneeze, all the stuff that's coming out of your mouth. Have you ever been talking to somebody and all of a sudden you see a spray? Unknowingly, like you don't, like all of a sudden your mouth is like,
some people more than others.
And you're like, oh, I'm sorry. Just imagine being infected with a virus and doing that to somebody. Yeah. Like, you can't cover that up because it happens. That's why people saying wear a mask. Why you're out there in front of somebody's school telling them you don't want kids wearing a mask, I don't get any of it. But thank you for just clearing that up. And then now we're starting to see on airplanes, they don't want you to wear cloth masks because they're less effective. And that just like threw people off too. Like, oh my God, what? You mean my mask? It doesn't, like, people, like, when more information comes up, let your mind be open, because it's a novel virus and people are learning new stuff. And so and you have to be open to the changes and the situation and the way people react to it. It's an ongoing, evolving situation. So don't close your mind once you hear something, and then, because I'm hearing people like with old information, and that's not going to help you.
Correct.
Going forward.
And that's one of the things we focus on in the workshop, just with the mask thing. And then also we talked about just how the information, it's just evolving, because we still don't know what we're working with. This is a virus and this is like a super virus. Yeah. I mean, people are getting blood clots. Have you ever heard of viruses? I mean, think about respiratory viruses. Usually you have the rhinovirus, you have the syncytial virus, you have the influenza virus. Those different types of viruses, usually it's like fever, body aches, chills, sneezing, variation of symptoms, but never to the point with
people were having strokes.
I mean, I'm like, oh my gosh, I don't even know. I wouldn't even know how to approach that as a practitioner, even though I feel like I'm extremely knowledgeable. But I have to be, and that's another thing. If you don't really know something, that's part of that training that I love, that I receive from my preceptors. If you don't know, just don't comment on it. Do the research and so forth. But because I have such a solid biological science background, I wanted to let people understand, like how viruses work and how the vaccines
That's where
work.
It's at. That's where it's at.
Because one of the things is, I feel like when you know kind of what the quote was that you said by Nas, what was that again?
They fear
what they don't understand. So my goal, and you guys' goal, helping people connect the dots, our goal is to make sure we give them credible information, and where they can find that credible information. Because when you have one of the concerns that I have, where you have outlets that are not even medically based, they're just pumping out just information, and it's not even, and you're just like, wait a minute, where are they getting that from, or who they?
There is a research that was done, and they say that there are 12 people that are responsible for the majority of the misinformation that's out there, and those people, most of them are just paid public speakers. One particular group of people, they don't believe that there is a such thing as a virus. That is a huge thing in our community because of a natural herbalist that shall go nameless. But one of his things is, everything is because of mucus. There's no such thing as a virus. So if you just eat and drink and you'll be immune to anything, because really there's no such thing as a virus. And that is hurting a lot of people. So can you give us like the virus 101 of what a virus is, like just what it is, like just like what you may have learned in high school? That's where we learned just bacteria versus virus, that we learned way. I don't know what. Maybe they only taught that at my school. I don't know why everybody like lost that.
Yeah. And so one of the things is the simplest way to put it is something foreign for your body. So a foreign organism that comes in your body, right? But it needs you as a host. It needs you as a host in order to replicate. And then when you sneeze, you spread it out, goes to somebody else, and you use them as a host. And that's how, and it needs you to, that's basically what it is.
So you have to get it from somebody else.
And then the things with viruses, with COVID-19, that's a respiratory virus. So we know for a fact that because it's respiratory, it is it's in those mucous like membranes, so it's going to be sneezing and the coughing and the laughing and the talking as far as that, because it's droplets, which is how it's spread by the and so sometimes we call it not the sensible loss, but just the saliva that comes out of our mouth. So one of the things is with that is, I want to back up a bit. Coronavirus is nothing new.
No.
I think I told Dom that my son, he's 7 now, he was in ICU with coronavirus in 2017. Coronavirus, essential virus. He got pneumonia from it and was newly diagnosed with asthma. It's just this coronavirus is new. That's why they call it novel, with Latin for new. So that's why, but it's always been a very pretty bad respiratory virus. It's just now it's like on steroids.
Yeah.
And I say not literally steroids, I'm just saying like it's like mutant.
Yeah.
And so and I also wanted to highlight about the individual, I won't say the name, but I know who you're talking about. So I am with me being West Indian, I'm first generation American, my family's from Jamaica. I do have strong beliefs, even though I'm in practice, about like when the body is not as whole as it should be. Like for instance, when you're obese and there's a lot of inflammation going on and a lot of mucus, your immune system is lower and you're more susceptible to being sick. So that's the truth part of it. But one of the things is that you still don't know if you're going to get it or not. So I believe in doing everything. Getting the vaccine, try to get your workouts in, be fully rested, because anytime your body is in an extreme, that's how I talk to my students. I said, when it comes to healthcare, what we're trying to do is get everybody back homeostatic. We want homeostasis, that's it. But when people are sick, that's an extreme. So an example, when people have sugar or diabetes, the extreme is their blood sugar is too high, too much sugar, and the other extreme is their blood sugar is too low. And we want their blood sugar to be in the middle. So that's just in a nutshell when it comes to health. We're trying to get ourselves balanced and in harmony. So all of that stuff actually has a root in it. Let food be thy medicine has been something that's been around for a long time. And remember, things have shifted so much with how foods are prepared and the inflammation and just, there is root to some of what's said, but we have to also be the virus. There's more to it, because a virus, people would take one thing and then make it that big.
And that's what I try to explain to people. Like a lot of people that, because me being a science-based background also, I had a friend, a pretty close friend that is battling. She's sick right now, and she's a very holistic person. And I understand that. Like I understand plants, and 95% of medicines come from plants. But I was telling her, always remember that two things can be true at one time.
Yes.
It's kind of like
he's always spitting out this knowledge. I'm like, it's a tweetable moment every time with Dom.
That's true though. Like you can be as healthy, but this foreign thing, you know what I mean? This foreign thing is gonna come and it attacks you. So in my mind, I'm thinking, yes, I agree. I think that you should eat healthy, eat things that have seeds, eat green, exercise, do all this stuff to become as healthy as you can. Yeah. But also understand that this foreign thing that's out here, you can start today, but this thing is on your back. You know what I mean? This thing is out here spreading like crazy. So your body, you might not have time to like, okay, let me start eating healthy today and exercising today, and maybe I can escape this virus that's like after everybody. This thing is after everybody. It's a foreign thing. It's not coming from you.
Right.
People think that because people in this country are so unhealthy that this thing is just happening all of a sudden to unhealthy people, obese people that are diabetic, so they think if they don't have an underlying health condition, they've got one up, so they don't necessarily have to get vaccinated, or they've got one up, so if they do get it, they'll be fine. And that's a horrible way of thinking in the middle of...
So they're basically, it sounds like you're saying they're thinking that the virus is discriminatory versus...
Absolutely.
Yeah. And it's not. Even though the research is showing that those people who are succumbing to it, passing from it, they do have underlying health conditions, which we also call comorbidities, and a lot of them are overweight. But that's not just... People are dying in general. And sometimes when people hear stats like that, they focus on certain thing to make them feel good, whatever narrative they want to hear and connect
because
to.
It's scary.
Yeah,
so
because it is scary.
Yeah.
But we just have to be aware that it's different people are dying from it. I've seen pictures of young, healthy people, perfectly healthy. They're dying from this. They were not overweight. You didn't have any underlying health conditions. 23, 34. I saw a 34-year-old. I mean, that hurts. When you see people dying who don't have to die. Yeah. And all we have to do is put on a mask and wash our hands, which made me wonder, like, were they not washing their hands in the first place? But then I'm not even gonna go there.
I really literally go through my mind when I see people saying this stuff, and I'm like, so do you not wear masks? I mean, do you not wash your hands? Do you not wear condoms? Do you not wear seatbelts?
Exactly.
Like, when HIV came out in the beginning, you're Gen X, so it was. Yeah. I mean, I was young.
Remember that push,
we were
that
young.
campaign?
That campaign was huge. And I mean, in the beginning, people were really like, oh, I don't know, should I eat behind this person? Is it saliva? There was a lot of, but it didn't go this far. Once they found out it was a sexually transmitted disease, condoms, and I never saw nobody outside like, free the penises. We don't want to wear condoms. we should not ever have to, like, this is just so weird to me. Like, this is so weird to me. And every time somebody inboxes me like, we're not wearing masks, don't conform. And I'm just like, what are you guys? You're weird.
When and then the energy that they put. Honestly, you should be able to come out this pandemic at least with like one business idea or something, or some type of personal growth or development. I mean, if you're going to put your energy, and we're having it for educational purpose, we're having this conversation, but just to put it out there, putting a message out there for some of you folks that are so on that topic, just relax for a moment and just realize that one of the reasons why they're pushing masks is because they're understanding that the push for the masks is because they understood more of how the viruses was being transmitted. So that's why there was such a push for it, the same way there was a push for us to use like condoms and get screened before you engage in sexual activities. Anytime there's a push for something is because we're understanding it even more. There's a possibility that there'll be a push for something else later, just to be open and to it, that there are scientists who are working around the clock. Yes. And it's interesting for people who have not even gone through the rigor and the intensive. Like, I got gray hair before 40. It was like all the stuff that you go through in order to have this, to be in this position, and then people just be like, I'll just Google it.
So you nice. I tell people like, bruh, you had a 52 in science in high school. Why are you arguing with me? Like, you know what I'm saying? It's like, it's those people that like, it's frustrating, because it's kind of like, I really probably could help you learn if you wanted to.
Yes.
So that, I think that's the stressful thing when you meet people, is like you understand that some people just don't want to get it there.
I just tossed it up to, it's scary. Mm-hmm. Some people deal with pride. Mm-hmm. Some people are dealing with just an emotional response to trauma, because this is traumatizing. I mean, they threw you out of school, they threw you in home, they told you don't go nowhere. That was crazy. So I'm thinking that that's how people are reacting to new information. Some people's minds are not open to change. Mm-hmm. Some people's minds aren't open to evolution. Yes. And so those are the people I kind of like try to hold their hand and walk them through this. What else was on here? I could damn near hardly see, right?
I'm about to say, another topic.
Oh, this week there's a new sweeping vaccine mandate for 100 million Americans. And in his
So it's cool. Joe Biden. So I think if you've been watching the news this week, you've seen that President Joe Biden passed a sweeping new vaccine mandate that's going to affect over 100 million Americans.
Yes.
And the interesting thing, it says in his most forceful pandemic actions and words yet, President Joe Biden on this past Thursday ordered sweeping new federal vaccine requirements for private sector employees as well as healthcare workers and federal contractors in an all-out effort to curb the surging COVID-19 variant. The president says, "We've been patient, but our patience is wearing thin and your refusal has cost us," he said, all but biting off his words. "The unvaccinated minority can cause a lot of damage, and they are." The expansive rules mandate that all employees with more than 100 workers require them to be vaccinated or test for the virus weekly at cost of the business, affecting about 80 million Americans and the roughly 17 million workers at health care facilities that receive federal Medicare or Medicaid also will have to be fully vaccinated. So this is basically
that had the internet in a shambles this week. Twitter was crazy, Facebook was crazy. Everybody's like, "Oh my God, look what that." They completely forgot the testing part. They just were like, he's putting you have to get vaccinated if you have more than 100 workers. And I'm like, no, that's not what he said. But okay, he said you.
There
can,
they go,
you can,
taking one small part and using it as a narrative.
You can get guys. There's a global pandemic. 650,000 people roughly in this country have died to date from COVID-19. Right? What are we gonna do about it?
Yeah.
You know what I mean? Like, what are we gonna do about it? You see what it did to the economy. You see what it did to everything. What are we gonna do? Like, we have to do something. Denying it is a thing was the first reaction that didn't work. You see where that got us. That killed about 200,000 more people. Denying it, playing it down, that didn't work.
Yeah.
So now we have somebody that's actually trying to implement something to mitigate.
Right.
So like. Where am I wrong? Like I don't know what, like we have to do something. The only thing we can do is first find out who has it, right? Try to cut that off at the root.
Yes.
Isolate
them.
that and let the other people go on, because the economy, everybody has to, you want your kids back at school, you want to go to the party, you want to go to the club, you want to go to the concert. We have to do something to mitigate. And everything that's done to mitigate, people turn it around like, if the government makes you wear a mask, they're going to make you. Like, they're literally telling people that this is the beginning of going back into slavery. Like, that's the rhetoric that's on the internet right now. Yeah. If they make you wear masks, then if you let them feed you, then you can let them starve you. And I'm like, dude, you could you could go work for yourself. Yeah. You know, these people have a responsibility to try to keep their business running.
Right.
So if everybody's sick, because you've seen schools, I've seen schools in DeKalb County shut down because teachers are dying. Yeah. I've seen schools in Atlanta. Shout out to APD. APD must be run by a black woman. Is APD?
APS?
APS. Okay. Oh, sorry, not APD. Sorry, Atlanta Public Schools. Sorry, Atlanta Public Schools. Atlanta Public Schools. Shout out to them, because they've implemented a way where they will be testing the students, they will be testing the teachers.
So to interject, since you're headed to that way, that's one of our points. Mandatory testing for Atlanta public school teachers began this past week. APS public schools will make COVID-19 surveillance testing mandatory for staff starting Tuesday. It says teachers will be tested for the virus twice a week.
Good.
Quote, surveillance testing will allow us to keep our momentum of quality in-person learning and minimize the risk for everyone. Even if you are fully vaccinated or have no symptoms, you may unknowingly expose others to the COVID-19 virus, says APS Superintendent Dr. Lisa Herring.
Yeah, and so you have to, as a parent, sign a waiver and let your child be tested. So I commend parents that have made that tough decision. But you are a part of the solution. Shout out to APS. I think that should be a nationwide thing. I think that when this happened, the government should have sent everybody a mask back in 2020. They should have put a mask in the mail before they sent checks and all that.
We're putting them stimulus checks in the mail.
Before we got our stimmy, I think they should have put a mask, kind of like a something to explaining to people about how viruses community spread, just explaining, so we could have, there's no base knowledge. That I kind of blame the government for. There was no kind of like education. So it's left up to people like you. I mean, we had the public.
I'm trying to hold my breath because I'm like, well, we had a different person.
Right.
But I need people to understand that too, because people kind of say, oh, the CDC lied and now they're changing their story. The CDC was a whole different group of people when we had a different president. Mm-hmm. When he changed, they changed. So they kicked out a lot of the people that worked at, so I don't think people saw where it changed, and they kind of just have a blanket idea of the CDC and all those regulatory agencies, and not kind of understanding when it changed from one hand to the other and the message changed.
And that was pretty much going on. Like President Donald Trump basically just made the lives of the CDC heads really, really hard. Because it's kind of like being in the military. Like if I'm in the military and I'm under the operation of this general, if he gives me orders, I either have to do those orders whether I agree with them or not,
right,
or I'm going to be in the clinker. And so that's why.
And that's the position that they were in at the CDC at the time.
Their hands were tied, so I don't even think we should. I mean, I feel we need to just take them out of our mouth. People they just want to point at different organizations like they're a lot of individuals, and there's so many levels of healthcare and research, and many individuals are doing the best that they can. Yes, there are some that are giving out misinformation out there, which is why I'm grateful for platforms like this, especially for our community. I commend our community because we are doing better. We're wearing masks, and I see that a lot in the Black and brown communities. We're not, because before the numbers were bad.
It was different.
It was different.
Yeah, it was different. But when
what
that
happens,
other guy was the president.
And so we got the information out, and we're talking. And you know how it is, like when you and how it works when it comes to our community. You educate the woman in the family, and she's going to break it down, and she's going to tell her sons and and her daughters. Yeah. So that's so that's very good, and I think there's been a lot of improvement in that, and it's one of those things that I had to learn this. I taught high school before I went into nursing, and I was told, my maiden name is Brown, and the assistant principal was like, Brown, you can't save the world, so you just have to do within your group. Like for instance, the people who are tuning in, we're educating them, right, with hopes they'll educate the people in their group, and after that we're done. We gotta just like chill after that, because you're doing a great job. You guys are doing a great job. You're welcome. Thank you.
So tell us what you guys have going on over at the magazine next.
So we launched an online coaching program called NP Student University, for short NPU, and it's a membership that students could enroll in to get the support that they need while they're in school for some of the complex content. We really focus on the core education part. So the core of most medical training, specifically with the nurse practitioner training, is the diagnosing, physical assessment. You got to be great with physical assessing before you diagnose. Come up with the right diagnosis so you can prescribe the right medication or treatment, and then the evaluation piece, and know how to talk to your patients. So those are very core, and that's what we focus on, because there's so much that you can talk about, but because it's so new, we're just focusing on one segment. And I really believe that with us focusing on that, we'll really help them feel comfortable while they're outside, while they're practicing. And we started a GoFundMe just to support us with the platform and to get some additional coaches. We have to train those coaches and then compensate them. So we just started a GoFundMe just to jumpstart it, and also to help with that marketing, because we're trying to reach out as to many nurse practitioner students, and for those who are new NPs, if you're interested in that, we're there for you as well. But what's happening is sometimes they don't know where to get the resource, and it feels great to have a face-to-face conversation, or just some almost like a consult with someone and so forth, because oftentimes they do feel embarrassed going to their supervising physician. And we're in Georgia is one of the practice states where we have to have an agreement on file in order to practice for nurse practitioners. So sometimes they feel embarrassed because they're like, wait a minute, I should know this and I don't. So that's where we come in.
Oh, that's good. Where do you tell people how they can donate to the GoFundMe campaign?
So you can go to our homepage at npstudentmagazine.com. That's N as in nurse, P as in practitioner, student magazine, npstudentmagazine.com. And on the homepage, you will see our GoFundMe link where it says help us.
Literally.
Yeah. Help us. Yeah. We just said, wait, look, we're not going to hide anymore. Really help us save patients at risk. Because most individuals, they're like, oh, you need to do this. I mean, I've heard it all, but I'm like, look, this is a community project. And,
yes.
I'm focusing more on Georgia, and I want to branch out. The magazine is a national magazine, but with this program, I could only, as far as like hands, I only have enough hands for us to focus on the state of Georgia. But this is a community project. When you have competent nurse practitioners giving you the correct diagnosis, prescribing the correct treatment,
understanding because they look like you.
Exactly, because the individualized care, exactly. When you have that, you're less likely to have medical errors, injury, and death. All this malpractice and stuff that goes on. A lot of people don't know about the malpractice with that. We get sued too, just like physicians, when you make a mistake. And some of those mistakes are not necessary. I mean, it should not, those type of mistakes that have been happening should not occur. You should not be missing something as simple as pneumonia and not sending the patient right away to get the right treatment, or not thinking about having them get an x-ray. I mean, you can't be missing those things. That's common. So that's what it's about. It's really about you and your family members. Because you can advocate for yourself, but what about your grandma and your grandpa, and they may not be able to advocate for themselves?
You might not be able to advocate for yourself if you can't talk, if you're sitting in the hospital and you're unconscious. Exactly. And people have to make decisions for you. So my philosophy is always be proactive instead of being reactive.
Thank you.
And so if you contribute to the education of a nurse, you're going to help yourself in the event that you are hospitalized, in the event that somebody in your family is hospitalized. You are taking a proactive role in making sure that nurses have the education, nurses have the understanding, and that nurses that look like you and talk like you can understand you in the event that you might not even be able to communicate for yourself. Because think about it. If you're in the hospital, you're not in there to socialize. If you get to the point where you need to be hospitalized, you need somebody that means business. And I've heard over and over again people say, when black women get to the hospital, they are treated differently. When black women get to the hospital, they're not taken as seriously. It's like some people are of the thought that black women can tolerate pain more. These are some of the things that people were taught. This was part of some of the things that people, when I say people, you are a person before you have a career. Correct. You're a person before you pick to be in politics. You're a person before you pick to be in the medical field. So when you're interacting with politicians and we're talking about the CDC and doctors, these aren't just people. You know what I mean? That chose this path. Yeah. So they come with certain, prejudices and ideas.
Yeah, and we all do. We all do certain types of biases, and that's where the magazine comes in. The magazine, we do a lot of educating, and the magazine for the past couple of years have been a complimentary resource. So when you have a platform that's been complimentary for years, you do need that capital to push the next step in as far as with the education, and that's what you need. And things, and it used to be that way years ago in the black community, where if someone was going to get ready to go to college or do something that was going to make the community shine better. People would pull together
behind
funds
them,
and be behind them and support them.
Hey, I remember them support packs when I was on. They real, for sure.
Yes. So that's why all of us are here, and it's like, and I always think about it. What sense does it make? Because I always like to refer, not always, but in this sense, like to refer to the Bible when I think about with Esther and some of the things that, you know, when her uncle went to her and was like, look, if you don't open your mouth and say anything, they're going to come after you too, because, you know, you're a Jew. And so don't act like just because you're up here in this tower, they're not going to come for you when they kill all the Jews. Well, I look at it the same way when it comes to us. Like, it's just, I mean, I'm a Black woman. I have Black family members. They could be impacted too. So what does it look like for me to be in this position and have this mandate on my heart and not do anything about it? You know, it doesn't, and so many of us do that. We graduate, end up doing very well, and we're just like, whatever. But I believe we're supposed to pick at least one thing that we're passionate about as far as giving back, and that's what we do.
Yeah. So I know it's mostly for nurses that are
nurse practitioners.
Yes. But what if you are not? Can you would you still have something in your magazine that they can get out of it?
The regular nurses can, as far as certain things like what are the 5 things you need to be doing after the first week of school, because we address like some of those commonly asked questions, or like right now we have someone working on an article.
I was reading an article about the 5 things you know about COVID and stuff like that, and it's memorable because you list them. Like,
you list them, yes. So we have someone working on an article now about like how to talk to your preceptor, because we have an editorial calendar. That's how magazines are run. Mind you, I have no journalism background. And I just launched this platform, but I am connected to a great source where I could get insight.
If you don't know, find somebody that does.
Yes. And so so one of the things is we cover some of those frequently asked questions that go that you have while you're in that life cycle, and the nurse practitioner student life cycle. So that's from the time they said, I want to be an NP. Okay, so what is a nurse practitioner? All the way to, okay, what do I do next now that I've graduated? What's the next 10 things that you do? And I wrote out like all the steps. There's like 30 steps or different things you need to do after graduation before you work your first nurse practitioner job. And most people don't understand that. Then the schools are not doing that. So we're filling in a gap, as Dom had mentioned. We're like the first platform that's focusing on that. And I mean, now you see all different types of platforms popping up all over the place that are not Black owned, which we already know that history. We will work on stuff and build it and innovate and put it out there, and they will take it and try to run with it because we don't have the capital to do the marketing and do the stuff that they can do quickly. So I'm in this time where I'm like, look, it's about getting the message out there and really dominating the fact that this is just something that it stemmed actually from my doctoral project. So I've been working on this even before I launched the business.
Wow.
So I eat, sleep, and breathe this. I've had an opportunity to contribute to a nursing textbook. Not many of us write the books. I've had an opportunity to advocate on Capitol Hill as an intern for Nurses in Washington intern in 2018. And then recently I had an opportunity to share these same insights on our local news. So clearly, you know,
I called. I was like, I see you on the news.
I know people were like, I saw you on. I was shocked. I was like, oh, it was on. Like, I was like, because they, you know, aired it a few times because of the gravity of the situation. This is, and for some reason, people are not as proactive as you mentioned. It's almost like they're waiting. Same thing with the COVID-19. We could close out with that. I'll close out with that with my thought. It's like, people are almost having to experience it. Why do people have to why do you have to directly experience certain things before you believe it's real? Amen. Like, same thing, that's what our platform is. Why do you have to directly experience malpractice before you realize, wait a minute?
So my grandma said the best lesson is the bought ones. You don't forget those. If you literally learn something the hard way, you never forget it.
Well, I don't want to learn the hard way, and I don't want
I
y'all
don't want
to
learn
either.
this thing the hard way
So
either.
I'm wearing my N95 mask, and I'm wearing my surgical mask. I have different masks for different occasions, depending on how close I'm going to be to people, right? If I'm going to be super close to people, I have an N95 mask. If I'm just having a general walking through the store, I wear a surgical mask. If I'm feeling a little extra, I'll put on a cloth mask on top of it. But just get vaccinated, wear your mask, wash your hands, do whatever you need to do to prevent this, because this thing is barreling down and is looking for hosts.
Protect
and don't be a host.
Protect your family.
Yeah.
Protect yourself, protect your
family.
family, protect the children that can't get vaccinated yet.
Yes.
Make them go to school with their mask on. And if not, let them learn at school, at home. But they need that interaction. So I don't know why you guys don't want your kids to wear masks, but I think they should.
I think they should. And it's so funny. A lot of the children, they will do whatever you
They
tell
will
them.
tell. They will
They're
do
going by
whatever you
what
tell them.
mom and dad
But mom
say.
and dad aren't.
Yeah,
Mom
but
and dad
mom and
aren't.
dad-
Some of the moms and dads aren't the sharpest cookies in the box or sharpest crayons in the box. I'll just say that.
Yeah, I mean, all of this resistance is not necessary. You know, like I always like to vibe on the right like frequencies for the energy, and a lot of times when people do that, you're just you're already making yourself susceptible because you're vibrated too low. I'm not trying to be funny, but you're so angry.
It's always coming from an angry place.
Yeah,
It's never coming from a
exactly.
rational
It's not
place.
coming from like love.
If there's something that you truly believe in from love, from a love place, it's communicated differently.
Yeah.
But
yeah.
I don't ever see them. They're always like, "No, you're not going to take my freedom away." Like, what are you? And then I'm just like, I don't know what to do with that energy. That energy is like, let me get sick if I want to, and if I want to get everybody else sick, I'll do that too. Like, that's what I hear when I see that.
Yeah, we do hear that, and then we're still seeing. I don't know if you guys seen it lately. There are a lot of people are doing, and I'm so grateful for those people. Unfortunately, that are passing, but before they pass, they're doing
like,
something.
"Oh, I should have got vaccinated."
Exactly. And that's the part I'm grateful for. So I don't want people to think that I'm grateful that they passed.
No,
But I'm
right,
grateful for
yeah.
the fact that they're saying I was wrong, and that's very humbling, because it takes up and the death that hurt me the most was and how did I forget his name? But it hurt me when he died.
What's his?
Herman Cain.
Herman Cain.
Yeah,
Okay,
you knew.
time out.
That hurt me.
Time out.
It
This
really
is
did.
our time for everybody. We're about to have a moment of silence for this Herman Cain Appreciation Day right now.
I feel like we've done this
We
before.
have. That's why I want to keep doing it, because I want to reiterate
I-
this. I want everybody to realize where Herman Cain is
That
right
was
now
that was the black Republican for Trump sacrificial lamb.
and why he's there. That's all.
Yeah.
That's it. Herman Cain.
Yeah, that was their sacrificial
that
lamb. That was
really
the
hurt me,
sacrificial
though.
lamb of misinformation.
Misinformation, and when he was at that
And none of them say his name anymore. Like
no.
half of them didn't even go to the funeral.
Well, now they have another.
He was a
group.
great businessman, by the way.
Yeah.
Oh my gosh! But it just hurts me because
He went to school right here in Atlanta.
for somebody to be so passionate about, don't wear the mask, it's a hoax, and this, that, and the other, and for him to, and it was like very quickly. It's like he died within like
2 weeks.
That's what I always remember. I remember
yeah,
him.
it was so quick, and it was
Because
just
they
like,
didn't mention him, and then all of a sudden he was dead. Like, if they would have kept it going, but they were shoving all that under the rug. All the people that were getting it back then, they were like just trying to hush. The whole cover up is the sad thing for me. The cover up of the people that were getting sick, the cover up of the deaths, the cover up of the monumental way that this thing was getting spread. It just, I'll never forget that. On my last note, I just want to thank you for coming in. Thank you for everything that you're doing. Please feel free to come back here, because we need that, and I just need that medical expertise to keep going out into the community, especially during a time like this. So if you don't mind, please come back soon, because we really need to keep these conversations going. And you guys out there, if you have any questions or anything that you need to say to us, let us know. Unless it's mean and rude, then keep that to yourself, because I'm not going to read that anyway.
Then send Dom, because Dom going to say something back.
Send that to Dom. I'm forwarding all that to Dom because I can't anymore. Make sure you guys pick up So Mississippi candles. I was going to put this in my purse before we started, but they urged me not to. But this smells really, really good. It's fall. The mornings are crisp and cool now. Open up your door, open up your windows, light these candles. These scents are amazing. SoMississippi.com. Make sure you check them out. Tell them how to spell it, Dom, because it's the Mississippi.
So Mississippi. I'm from Mississippi. My wife's from Louisiana, so we put it together.
So these fleur de lis people. That's what I call you.
Yeah. So it's SEAUXMS.com. So Mississippi. Thankfully, I want to thank you all, because I think last week we had a sale. It's the first time I ever completely sold out the site.
Woohoo!
So thank y'all for rocking with us. I am working on restocking everything now. So these candles that you see being displayed now, they are from the fall line, and they'll drop next week. So, next weekend, make sure you guys get online and check out what we got.
All right, guys, make sure you check out our previous episodes on innovativeblackstation.com. Also, subscribe to our YouTube channel, and follow us on Instagram on CTD_ATL. Dr. Patrice, do you have social media, or do you have a way people can reach you if they would like?
Yes, they can email me at info@npstudentmagazine.com. Follow me on Twitter and IG at npstudentmag, or at Dr. Patrice Little. That's DrPatricellie. And I agree with the same thing. If you're gonna send something to me, please let it be nice.
If it's not nice, send it to Dom.
Send it to Dom.
Send it to Dom. Dom is our bodyguard here. So you guys have a good week. Make sure you take all the precautions, because COVID is looking for you. Don't let them catch you. I'll see you next week. Peace.